Hello, my name is Maria Jose Lor. I am going to present my topic research, heart-to-heart authentication for implanted medical device. Definition is a system to authenticate external medical device controllers and programmers to implantable medical devices. EMDs, which include pacemakers and cardiac defibrillators, are therapeutic medical devices partially or wholly embedded in the human body. They often have both radio communication to facilitate non-invasive reprogramming and data readout. Applications: implantable medical device (EMDs) apply continuous monitoring and automatic therapies to the treatment of chronic medical disorders. The implantable cardioverter defibrillators (ECDs), which detect dangerous heart rhythms and administer electrical shocks to restore normal activity. Other EMDs include pacemakers, neurostimulators, and implantable drug pumps.
Implantable pacemakers and defibrillators are devices that apply electric shocks to maintain the rhythm of the heart and, if necessary, restart it. As the technology improves and the list of treatable conditions grows, the number of devices being implanted is increasing steadily and now exceeds 500,000 a year. The heart is made up of 4 chambers, 2 atria and 2 ventricles. On each side, the atrium is connected to the ventricle by a one-way valve. Blood is pumped as these chambers contract and relax in turn. The beating of a healthy heart is regulated by electrical impulses. The sequence begins as the atria fill with deoxygenated blood from the body on the right and oxygenated blood from the lungs on the left. An electrical signal from the sinoatrial node then causes the atria to contract, forcing blood into the ventricles. The electrical signal is then picked up by the atrioventricular node and directed into the Purkinje fibers in the ventricle walls, causing the ventricles to contract. And the blood is then pumped through the pulmonary valve on the right to the lungs and the aortic valve on the left to the rest of the body. These valves close and the cycle then restarts. When the sinoatrial node fails to function correctly, an artificial pacemaker can be fitted to help regulate the heartbeat with small, evenly timed electric shocks. This involves implanting electrodes into one or more of the heart's chambers by inserting leads into a vein near the collarbone and implanting a device called the generator just under the skin. For more severe heart conditions, an implantable defibrillator, or ICD, can be used, which is also capable of sensing a stopped heart and delivering an electric shock powerful enough to restart it. For some conditions, an even more sophisticated device, called a CRT-ICD, can be implanted. This uses a third lead inserted into the left ventricle to resynchronize the ventricles when necessary. However, all these leads can cause problems of their own. Patients with ICDs have a 20% chance of a lead failure within 10 years, and replacing leads can require open heart surgery in about 2% of cases. This has resulted in several efforts to develop new pacemakers that do not depend on leads inside the heart. One design, the subcutaneous ICD, places the lead just outside the heart under the patient's skin. And wireless designs are now being developed that may eventually do away with the need for leads altogether.
Your heart pumps oxygenated blood throughout your body. Rhythmic electrical impulses inside your heart cause its muscular walls to contract, ensuring your heart beats steadily. If problems occur with your heart's electrical system, you may develop an abnormal, potentially life-threatening heartbeat called arrhythmia. Your doctor may want you to have an implantable cardioverter defibrillator, or ICD, to restore the heart's normal rhythm and prevent sudden cardiac death. During the procedure, your doctor will thread a small wire through a vein until it reaches your right ventricle. The wires continuously monitor the heart's rhythm. After verifying the wire is in the correct location and works properly, your doctor will attach the wire to the ICD generator. Then your doctor will insert the ICD device under the skin of your chest below the collarbone. The battery-powered ICD constantly monitors your heartbeat using a computer. If a life-threatening arrhythmia occurs, the ICD delivers an electrical shock to your heart, resetting your heartbeat back to normal. The ICD can also be programmed to pace the heart and restore its natural rhythm.
Pros and cons. Pros. Powered EMDs typically contains radios to communicate with external devices called commercial devices programmed that can reprogram the EMDs and extract phasing data from them. Such wireless communication enables secure and non-invasive access to EMDs. H2H protects phasing data in two senses. One, can track a phasing wireless from a distance, and two, the reentourment of prevents lack of medical significant data, cardiac abnormalities evident and the full ECG waveform. Cons. Some design found in a common ECD that allow trackers to take unauthorized control of the air and potential harm victims. Even access control police are not reasonable permissive when life-threatening. There are fatal delays in communicating with care providers to obtain device-specific password or case. On the other hand, overall flexible access control policies can expose patient medical data.
Tomorrow's medical devices are going to be much more interoperable, different devices talking to each other, and it'll be so much more important to secure that wireless communication between all those devices.
This is an experiment setup for the security of medical devices. We're using a synthetic human. Particularly, we're looking at interference.
Researchers have identified a new security risk in the sensors of medical devices such as implantable cardiac defibrillators and pacemakers.
In my laboratory, we look at how to improve the security of devices ranging from RFID-enabled credit cards to implantable medical devices. This is a defibrillator that was explanted from a patient and was donated, and we use these devices to test how secure they are. And our research explores how to make sure that the wireless interface doesn't lead to a compromise in the system. All electronic devices emit different kinds of electromagnetic interference, and they can interfere with medical devices.
The researchers found that they could use radio interference to send false heartbeat signals to the devices in controlled lab conditions. Theoretically, a false signal could inhibit needed pacing or cause unnecessary defibrillation shocks. Experiments show that this would be very difficult to do in the real world, however. Researchers say patients with these devices can be confident that their implants are safe.
Today, by and large, I don't see much intentional harm being done to a medical device. In fact, I'm aware of none. I think patients today who are prescribed a device are much better off with that device than without. But the kinds of research we look at in my laboratory will enable future devices to be more available to patients without having to worry about the security issues.
If we can design particles
applied in a color. Pacemakers. Its purpose is to stimulate the heart muscle via electrical pulses to ensure the smooth functioning of the heart. Intracranial pressure sensor system (ECP). The need to monitor intracranial pressure is related to a hip injury or genetic deformity. Biomedical telemetry system allow the exchange of information between external devices and internal devices. They are of great science interest and applied for medical prevention, diagnostic and therapy.
The Heartware Ventricular Assist System is a miniaturized implantable circulatory support system for the treatment of advanced heart failure. The Heartware system consists of a small, continuous flow pump with integrated inflow cannula, an outflow graft with strain relief, a drive line, an external controller, and external power sources. At the core of the Heartware platform is a proprietary suspension system for the wide-bladed impeller. Using a combination of both hydrodynamic and passive magnetic forces, a thin layer of blood is established between the impeller and the pump housing. During operation, there are no points of mechanical contact within the pump, effectively creating a wearless system. The HVAD pump, roughly the size of a golf ball, is capable of providing up to 10 liters per minute of blood flow. Its small size and integrated inflow cannula allow the device to be implanted completely in the pericardial space directly adjacent to the heart, thereby avoiding abdominal surgery. The implant procedure makes use of a proprietary sewing ring and custom apical coring tool, which allow the pump to be attached to the apex of the left ventricle. The outflow graft is then attached to the ascending aorta. Once in place, blood flows from the left ventricle through the inflow cannula into the impeller. It then exits through the outflow graft to circulate throughout the body. The driveline cable, constructed with fatigue-resistant conductor wires similar to those used in pacemakers, exits the patient's skin and connects the implanted pump to an externally worn controller. The controller is powered by 2 lithium-ion batteries, or one battery plus an adapter connecting to a wall or vehicle electricity outlet. The controller operates the pump and features a 2-line LCD screen to display parameters, alarms, and recommended troubleshooting concerning the operation of the system. The controller and batteries are carried in a case, designed to be worn either around the waist or over the shoulder, enabling the patient to resume normal daily activities.
Conclusion. Presently available EMD device can be wireless access and even upgraded, controlled by external devices under low access control policies. rendering them vulnerable to attack. This threat and the vital role of most EMDs urge urgent need for trustworthy parameter to EMD authentication streams. The touch to access policy is enforced in H2H via time-invariant biometric ECG heartbeat data. The end-to-end realization in an R-Cortex M3 microcontroller confers the practical and low overhead of H2H for our generation's EMDs. Thank you.